السلام عليكم مساء الخير. محمد يوسف, Image Guided Therapy Business Manager North Africa. Before starting, I just would like to thank Dr. Kashta for the interesting presentation. Now we can see that it's day by day we are moving into the minimally invasive procedures. So Image Guided Therapy, this is a world of minimally invasive treatment that Philips is providing a complete and comprehensive solution in each clinical domain while we are doing this in interventional angio suite. During the upcoming minutes, we would like to go through touch upon the technology, what we are doing in Philips to support the minimally invasive procedures, and we are going to discuss about especially lung tumors diagnosis and treatment. And then we are going to share a real customer experience about how we can integrate between the augmented reality Combeam CT or the 3D images and electromagnetic bronchoscopy during lung tumor ablations. So Smart CT, this is a new terminology which is defined by Philips, which redefine the concept of the augmented CT images that we are doing in the intraoperative with the angio suite or angio systems. So the Smart CT now, it's really using artificial intelligence applications, how to improve the quality of the Combeam CT, which provide more aiding tool to the interventional for the professors to depend on this type of technology in the segmentation, accurate image guidance during the treatment of the tumors. So some facts upon studies that we did regarding to the adoption of the Smart CT technology. Do you know that the recurrence rate of the hepatic carcinoma HCCs is dropped significantly if it's being treated with the 3D images regarding to the 2D images? The numbers is speaking. Do you know that the rupture rate of the intracranial aneurysm is dropped significantly if we are treated during or using the 3D augmented Combeam CT images? Stroke, we have invented a direct to angio suite approach. Direct to angio suite approach is supporting significantly in decreasing the clinical increasing the clinical improvement of the case, which is being treated if has been directly to the angio suite rather than go to the emergency, going to the radiology department to diagnosis and then has been decided for thrombectomy or not. However, we have learned from the experience that the adoption or the usage utility of the 3D augmented Combeam CT, it has a lot of challenges which is really need to be tackled. So what we have seen that some customers see that it's difficult to be done in the angio suite. They see that it's not really provide an easy and reliable measurement that the physician can do table-side module in the examination room without moving to the control. We see that sometimes the measurement is not enough, it's limited, that the measurement that has been done on the normal CT is comprehensive and give more insights. So how Philips is trying to do to tackle these three challenges? So we have designed the solution and we are going to illustrate one by one. Regarding to the difficulty, so we are now providing a visual room design for the team in the angio suite, how to properly set up the room for the angio or for the 3D imaging. We are providing the injection protocols, so it's now easy for the physicians or the interventionists to decide about the amount of contrast which is being used for the each and every injection. And we are providing the isocentering or put the patient in the region of interest without even reducing X-ray. So we are dropping the X-ray a lot and we are trying to attract the people to use the technology. Now we are providing visual guidance even for how the system is going to move during the Combeam CT acquisition in the angio suite. Last thing is the artificial intelligence automatic features or tools that we are providing for the automatic segmentation, automatic live guidance, and image fusion. So regarding to the measurement, which is not accessible in table-side module, this is the number of the measurements that we are providing now for the doctor to be used during without going to the control room. So we can see that we can scroll 3 MBRs as if we are using a normal CT workstation, and we have rotation, zooming, automatic segmentation, center line, 3D landmark, and overlay, as we said. Regarding to the third challenge, which is the limitation of the measurement, this is the list of measurements that we are providing in our lab systems now. So we have curved MPRs, we have strength, we have center line detection, multiple vessel analysis, 3D distance measurement, semi-automatic 3D lesion segmentation, 3D contour, and the significant, which is more marvelous one, is the marking tool. So we can just touch the touch screen module, which is beside the patient, while you are under sterility. You can just point at whatever vessel you need, and you will get the real measurement regarding to the contour, cross-section area, volumetric, and even you can draw a visual stenting without being disturbed regarding being under sterility. So the smart city concept has been built on the feedback we got from the customers. So we heard and we listened, and we now try to provide the proper tools. So the main concept was about providing superior patient care. We need to improve the lab performance, and we need to provide our user with excellent user experience during interventional treatment. So this is the whole packages. We have Smart City for vascularity, we have Smart City roadmap, which is 3D roadmap. We have Smart City for soft tissue, which is needed for the soft tissue like lungs and livers. And we have the Smart City intravenous, as if we are doing in the radiology department with a normal city. All this can be accessible with the table-side module. So this is the clinical packages where we can apply the smart city. We can do it in neuro interventional, we have to do it in vascular, oncology, and in congenital heart disease as well. So some facts about the adoption of the new smart city packages. 100% of our customers decided that it's intuitive and easy for use. 89% is decided that it's provide the right and proper treatment. It's supporting in this. And 83% decided that, or they brought the feedback that they can focus more and more with the patient because there is no any disturbance regarding to being sterilized and no need to go to the control room frequently. 100% decided that it's a high quality care. So it's now we are influencing the adoption of the minimal invasive procedures because we are providing the tool that they need. Increase usability. It's now the last score, which is 83%. Decided that now we are increasing the usability of the community. Now let's touch upon the theme of the Congress, which is the lung tumors, lung tumor ablation, and we would like to see that how Philips is providing minimal invasive solution, how Philips is integrate between the augmented reality complexity images with the electromagnetic bronchoscopy to reach an accurate and optimum tumor ablation treatment in the angiosuite lab. So here, this is the 4 main steps or main stages of the minimal invasive treatment of the lung tumors. We need to decide, so in the decide stage, we need to decide about the lesion segmentation, accurate lesion segmentation, and we need to decide about the optimal trajectory of the needed insertion, and we need to provide the guidelines for the needed guidance, minimal invasive, to do the proper insertions. In the guidance and treatment, we need to provide an effective navigation solution at a reasonable amount of dose and time, because we know the navigations, it needs dose, it needs a lot of time, so we need to facilitate or decrease significantly the time needed during the navigation by providing proper and easy solution for navigations. To confirm the result, we need to decide about the endpoint of the ablation. So then we need to do another CT intraoperative rather than waiting for the patient to, after going to the CCU and also the emergency, sorry, to the radiology, post-operative to do the CT to decide about the endpoint of the ablation. We can do this in the, while we are still can make more or less inside the room. So this is the softwares or the packages that we are delivering to support our interventional during the tumor ablations. We have expert guide ablation planner, and this planner is unique and has a very effective functions that we can plan for multi-needles insertion. We can see the effect of the ablator itself, so we can decide where is the effect of the ablation, not to touch the health issue. Expert guide live guidance, which is another very important tool, which is facilitates the navigation step. And after that, as I mentioned before, we can still do the COMP-CT to decide about the endpoint of the ablation before even remove the needles. Maybe I need to increase the power of the ablation or something, because I still have the needle inserted and I still can decide about the endpoint of the ablation. We can see that we can as well integrate with the PET-CT images, and we are certified for less than 1 centimeter lesions ablations. With PET-CT images, we can decide about the tumor activity as well. So in the upcoming video, it's 3-4 minute video, we are sharing a real customer experience about how we can integrate between the 3D augmented reality COMP-CT images with the electromagnetic bronchoscopy during the ablation. So thank you for your patience for this 3-4 minutes video, but it's really worth watching.